My name is Shiv Bhanot. I am a urologist and I work at King George Hospital in East London. Prostate cancer can be divided into different stages. It can be within the prostate, we call it early or localized, locally advanced, or it may be cancer which has spread to far off places, which we call metastatic prostate cancer. Advanced prostate cancer, we have two aims of treatment. First and foremost is to keep the symptoms under control. And the second aim we have is to keep the cancer under control. Now, all treatments have their side effects. And if a man has already got cancer which has spread to other parts of the body, then it's important that we keep the quality of life as good as we can.
My name is Patrick Williams. I'm 61 this year and I was diagnosed with prostate cancer. Everybody wanted to help quite a bit. I mean, my Macmillan nurse in particular was incredibly good because she was able to look at a lot of things, in terms of how I was able to cope with things and, cope with daily life and doing day-to-day work and doing day-to-day things.
In advanced prostate cancer, if a man seeks treatment for his advanced prostate cancer, then he can be given hormonal treatment which will keep the cancer under control, bring his PSA down. The hormonal treatment will involve getting rid of male hormones from a man's blood. This can be done by giving tablets or by giving injections which can be administered monthly, 3-monthly or on a yearly basis. If hormonal treatment fails, there are several treatments we can try. The first one to try is androgen withdrawal, stopping anti-androgen tablets if a man is taking those. There is a chemotherapy, and then we have new hormonal treatments which are often effective when the first line of hormonal treatment fails. We are not expecting a cure in advanced prostate cancer. What we are aiming to do is keep the cancer under control and treat the symptoms.
I've had to learn to live with it and I've had to find a coping mechanism. And being able to find that coping mechanism is my own path. I think everyone has their own pathway of how they deal with things. Some people have family that can support them through this. Some people have friends that are much closer. Mine was I had to use music, I had to use laughter, and I had to use my own strength and getting involved with Macmillan on a bigger scale. If you have information is a key. It gives you a certain degree of confidence, right, to face whatever it is.